hypertension is basically high blood pressure readings when somebody comes to see the doctor in a clinic setting. Now, white coat hypertension may not mean that the patient has true hypertension. It may be induced by anxiety, may be induced by stress. When the patient comes to the hospital setting, they see the doctor for the first time, the blood pressure is high. But when we check the blood pressure at home, the blood pressure may be normal. I think it's important to make this distinction because these are patients who do not have high blood pressure. They only have high blood pressure in the clinic setting. Hence, if they are given medications for white coat hypertension, then sometimes when they go back and take these medications, they might end up feeling dizzy because the blood pressure gets too low at home. So therefore, I think it's important to identify whether they really have true hypertension or whether it's white coat hypertension.
That is why we never diagnose hypertension based on a single high blood pressure reading. Hypertension is diagnosed once we have taken 3 or more readings of high blood pressure measurements done at different time points. When the blood pressure reading is high in a clinic setting, I would often advise my patient to monitor his or her blood pressure at home as well. If the serial readings are consistently high at home, then we can diagnose the patient as being hypertensive. On the other hand, if the blood pressure readings are labile, sometimes high, sometimes low, and there's a great uncertainty as to whether the patient has true hypertension, we have a device called a 24-hour ambulatory blood pressure monitor, which may be useful to help us gauge whether the patient is truly hypertensive. This is a device that is worn by the patient either at the wrist or the arm and records the blood pressure readings continuously over a 24-hour period, giving us more accurate picture as to how that patient's blood pressure is behaving over the course of the day. If the blood pressure reading is high in a clinic setting, but the 24-hour blood pressure monitor gives us a normal blood pressure pattern over the 24-hour period, it means that the patient does not have hypertension and the high blood pressure readings in the clinic is due to white coat hypertension.
Well, thank you for watching. I hope you liked the video. If you do, please don't forget to like, share and comment. Thank you.